Hello, this is Dr. Jacob Deniakos at Sola Dental. One of the most common questions that we get is, what are dental crowns? Why do I need them? Let's start by talking about what are dental crowns. Now, you might have heard the term cap. It's a commonly used term on the street. Crown, cap, all means the same thing. Basically, think of a crown like a helmet that covers the top of your tooth. The reason that's important is because if you have a tooth that has a fracture, has very large decay, maybe it's had a root canal, that tooth is weakened. And ultimately, it's very liable to fracture and break at the most inconvenient times. You know, it's always a federal holiday, or you're out of town, we're closed. The whole goal is to make sure that we don't have that happen. And so a crown is designed to splint that tooth structure together and to make sure that that tooth is nice and strong. That way it looks good, feels good, and lasts you a long time. So what are the alternatives to dental crowns? In many instances, the only alternative is to do nothing or to take the tooth out, which is not a great option. And so a crown is going to be the most conservative way to help you save your natural tooth. Say, for instance, that you've been diagnosed with needing a dental crown. And maybe a dentist has told you in the past that you need a dental crown, or you've been in our office and we're told that you need a dental crown, and you're wondering, should I do it, right? Do I need to get this done? Well, let's talk about what happens if we don't move forward with treatment. In a lot of instances, teeth that need crowns have some kind of fracture, large decay, some kind of compromise to that tooth structure. And if we don't put a crown on that tooth, it's very common that we see these teeth fracture, typically straight down the middle, splits the roots in half, and now we're talking about a much more invasive, much more costly option, which we can handle that. But at the end of the day, our goal is to help you save your natural teeth and make sure your mouth is healthy for the rest of your life. What types of dental crowns are there? In general, there's going to be a few different types. We can sometimes look at doing full metal crowns, which we typically don't do those anymore. Some dentists will do things called porcelain fused to metal crowns, where it has some metal and some porcelain. Again, we typically don't do those anymore. Most of the time, we are looking at doing a full porcelain crown, goes over the top of that tooth. There are different types of porcelain. It's really our job to figure out what kind of porcelain you're going to need. But those types of porcelain all look very natural. They all feel great, and they make sure that tooth is nice and strong. One question we often get is, why would you not do this type of crown versus that type of crown, and what are our options? In general, most crowns that you're going to be seeing these days are porcelain crowns because it looks a lot more natural, and there have been major advancements in the type of porcelain technology that's available that allow us to give you something that's very strong and very aesthetic. It used to be the case where really the only option might have been to do a metal crown or a gold crown, which those are still done sometimes, but in a lot fewer instances because we have such good options available to us when it comes to porcelain materials. So is a dental crown necessary after a root canal treatment? Short answer is yes. Your tooth is weakened and needs something that's going to help protect it and make sure that the investment you've already made in the root canal is going to last you and it's going to be nice and healthy. So how does a dental crown procedure work? Of course, like any dental procedure, you're going to come in, we'll get you nice and numb so you're comfortable the entire time, and we always work with you to make sure that your comfort really is one of our main priorities. But basically, we go in, we do shape the tooth from the sides and the top, and we make sure that we have space for the crown materials. After which we will do a nice scan of your tooth. In most practices, if you get a crown maybe at a different office, a lot of times they're going to do the first appointment, shape the tooth, do a mold or a scan of it, and then send it off to a lab. At Sola Dental, we've actually invested in technology that allows us to have a lab quality crown done the same day here in our office. And so in most instances, you'll be leaving with the definitive restoration, the definitive crown that same day. Does the dental crown procedure hurt? In most instances, absolutely not. We're going to make sure you're very comfortable. We'll work with you the entire time. Our team are experts at making sure that patients are comfortable for whatever dental procedure is needed. We'll get you nice and numb, make sure you take breaks if need be, and typically it's a pretty quick in and out type of process. Are there any consequences for getting a tooth crowned? Generally not. Some patients, they might actually go to, say, a different country. It's a common thing, get a procedure done, and you might be just fine in that situation. However, we can't guarantee that the quality of the materials is going to be the same. The standard of care that you're going to receive is the same. Generally speaking, here in the United States, most of the time, especially with the advancements in different technology that we have, we're able to get your crown done. Most patients do awesome and have very minimal discomfort afterwards. So is it worth putting children's teeth in crowns? It depends on what's needed, right? If you have a young child and they're going to need a tooth for a few more years, but say that tooth is compromised, has decay or a fracture, or an infection that needs to be treated, we want to make sure we save that child's tooth if possible for at least the period of time that they're going to need it until their permanent tooth is fully erupted and in position. A crown, sometimes a stainless steel crown for children's teeth, is what's needed to make sure that ultimate tooth is healthy. So do crowns look like natural teeth? Generally, the short answer is yes. That is always the goal. We have some different options that we can do on our side to help you make sure you have a perfect match for your smile. When we do a crown, we make sure and check the shade, of course, the color. There are various shades of white, or sometimes we see yellows, but we typically want to shoot for white. We can even customize that to make sure that it matches your adjacent teeth and has a very natural look whenever we get done with the final restoration. Another question we often get asked is, can you get cavities on crown teeth? Well, yes, you can. And that's why it's really important that, of course, you follow good oral hygiene protocols, so brushing a couple times a day. Make sure you floss before you go to bed and maybe use a mouth rinse as well. And you come see us on a regular basis for your checkups so we can catch things early and make sure and prevent that from happening. How should I take care of my dental crown? Basically, you want to brush and floss it just like a natural tooth. Aside from that, you can eat, chew with it, whatever you'd like, and come see us for regular checkups and we'll make sure it stays perfectly healthy. One question we get is, how long can I expect a dental crown to last? You know, the literature shows on average maybe 10 years, around there. But in cases where patients take care of their crowns, come see us for regular checkups, sometimes we can see those last 15, 20, or more years. Some instances it lasts a lot less though because they don't come in on a regular basis. So it really depends on how much you take care of it, making sure that you're keeping up with your follow-ups and that you're coming to see us and taking good care of your teeth, obviously every day at home. One question we get asked is, does dental insurance cover dental crowns? In a lot of instances, yes. Our goal is to ultimately help you out with making sure that you know exactly what's needed, what your insurance is estimated to cover, and what your portion's gonna be. That's really our job, to help with identifying all of those questions and making sure you have a very clear perspective on what's needed and what it's gonna cost. So one question that might be going through your mind is, hey, I've been told I need a dental crown, or maybe I think I might need a dental crown. I've been diagnosed to need a dental crown a couple years ago. What should I do about that, right? Really, the cheapest crown, of course, is the one you don't need. That's our job, to help you out with figuring that out. And so I'd like for you to ultimately just give us a call. Let us have a look at it and let you know kind of maybe you don't need one, maybe we need something different. We'll help you out with making the best decision for your treatment. I hope I've been able to answer some of your questions about dental crowns, but if you have additional questions or maybe would like us to check you out, please just give us a call at 337-993-3223. We're always happy to help.